Hi, my name's Craig and welcome to ECS Clinic. This video will walk you through how to take your lozenge-based cannabinoid medication. The lozenges come in a tray of 30. Pop out each lozenge as you need it. Depending on your prescribed dose, you can break the lozenge along the score line into halves or quarters. If you've been prescribed 1/8 of a lozenge, use a knife or pill cutter to cut a quarter piece in half. We recommend warming the lozenge to room temperature before cutting. Lozenges perform best if you're able to dissolve it slowly under your tongue. This allows the active ingredients to be absorbed through the lining of your mouth. If you don't like the taste of your lozenge, you can swallow it without sucking. The active ingredients will still work, it just may take a little longer to notice their effect. Your lozenges have been compounded specifically for you. Take them as directed by your practitioner. Store at room temperature and out of direct sunlight, and as with all medications, out of reach of children. Our team is ready to help. Let us know if you'd like help on this or anything related to your ECS treatment.